Last week, Governor Kate Brown announced new guidance and a three-phase plan for reopening counties and businesses. When a county has entered Phase 1, restrictions will be eased for restaurants, salons, gyms, and local gatherings, with requirements including physical distancing. Some rural Oregon counties with low numbers of cases have already applied to enter Phase 1 and could be granted permission to start as early as this coming Friday. The governor also provided guidelines for reopening childcare facilities on May 15th, with some limitations and specific guidelines. The state said childcare facilities should get more details this week about rules of reopening. Parents we spoke with on Thursday are anxious to hear more about the state's plan.
We're not going to be satisfied with any childcare.
Stephanie Michael is a mother of three. In March, they had to stop going to their daycare because of strict rules limiting the number of kids allowed at childcare facilities. But she's glad childcare facilities are part of the reopening conversation.
It makes me happy because anything talked about that isn't childcare isn't the first step. I mean, childcare has to be the first step.
Counties and regions will have to meet 7 prerequisites, including declining COVID-19 prevalence, before entering Phase 1 of the reopening plan. After 21 days of compliance in Phase 1, counties may be allowed to move into Phase 2. However, the specifics of Phase 2 have not been finalized and will be guided by data collected in Phase 1. The final phase, Phase 3, focuses on large gatherings. Those will not begin until reliable treatment or prevention of COVID-19 is widely available. The state announced that all concerts, conventions, festivals, live audience sports, and other large gatherings should be canceled through at least September. Some statewide restrictions have already been lifted. On May 1st, non-emergency medical procedures were once again allowed. On May 5th, some state parks and day-use areas were reopened. Christelle Kumwe, KGW News.